This video lecture is going to start us into the chapter on mental illness and cognitive disorders. A topic we don't cover much at all in typical A&P1 and A&P2 classes, but nonetheless, from a disease perspective, pathology, you do need to understand some of the physical or psychological things that can happen to a person. And so we'll go through a couple of different categories of disorders. This video lecture is going to get us introduced into the whole topic itself and talk about how diagnosis is in general performed. Now, I've organized it into a number of different groups of disorders, but one thing I want you to bear in mind is that all of these fall into spectrums. There can be very mild forms or very severe forms. I'm going to be presenting to you examples, signs, and symptoms of the textbook stereotypical forms. You may know of a case or of a person who has one of these conditions and they present, either more or less than what I described. Please understand that, like I said, I'm trying to give you the textbook version. Now, as we take a look at mental illness or cognitive disease is going to refer to when there's something physically affecting the ability to think. You can talk about a number of early signs and symptoms that can show up that we use to help us try and diagnose if something's happening to a person that's out of the normal as far as functioning of the brain. Now, as you're reading through this, bear in mind that, one of the rules I always give my class is that there's no self-diagnosis allowed. It'd be way too easy to look at somebody and say, well, I'm doing some of that, I'm doing some of that, oh my God. And so before you panic and start self-diagnosing yourself, bear in mind that these have to be diagnosed by a professional. And so when we talk about the professionals who do that kind of diagnosis, we're generally talking about psychiatrists or psychologists. A psychiatrist is a medical doctor. And so this is someone who can diagnose and treat mental illness, prescriptions, surgery, events like that. A psychologist, this is a PhD. This is more along the line of a counselor or a therapist. This is the person who would study behavior and help you to be able to analyze your own behavior and work towards that. So psychiatrists and psychologists can both work towards understanding mental illness and or cognitive disorder, but they do it from different perspectives. Now, the one thing that both groups do agree on is their Bible, and that's the Diagnostic and Statistical Manual of Mental Illness, called the DSM. And right now there's the 5th volume out. That's been out for over a decade or so. So I imagine we're probably getting close to time for the DSM-6 to pop out. It usually comes out about every 15 years. And they use it to organize and classify different disorders. And as soon as it's published, then there's a lot of people screaming and yelling. I remember when the DSM-5 came out, and Asperger's syndrome was now categorized as a subset of autism. A lot of people were very upset about that. So I'm curious to see how that'll be addressed in the DSM-6. Now, when you want to diagnose someone with a mental illness or cognitive disorder, first thing is obviously going to be a thorough history and physical. Find out about their past family history, their own personal history. Physically, if there's anything abnormal as far as neurologic effects, we can do technological visualization. So things like MRIs. CT scans, look inside the brain, see if we can find any kind of trauma, tumors, blood flow changes. We can have the patient fill out a mental health exam or a psychosocial history. And these are things that we don't typically use for any of the other organ systems we've been talking about. But now here, this is something that helps us to be able to figure out if there's something going on behaviorally or psychologically. And so when you look at things like the mental health exam, you can see some of the categories that it talks to. These work in areas that, as I said, we're not used to dealing with in normal anatomy and physiology. And so, understand that these are going to pick up elements that, typically, does the brain work is not going to answer that. This is going to more work on behavior, attitudes, orientation, mood. These are going to be topics and domains that are going to be new to us. And so a lot of my students tend to find this chapter very interesting because it does pick up into area they may have had some curiosity about, but has not been addressed in our EMP classes before. Once we diagnose a patient with a mental illness or a cognitive disorder, treatment could involve psychotherapy, either with the psychiatrist or the psychologist, helping the person to be able to understand why their behavior is considered abnormal and what they can do about it. May take medication. We're finding a lot of mental illness, cognitive impairments may be due to neurotransmitter imbalances, too much or too little. And so more and more medications are coming out there helping to rebalance those neurochemical pathways. We may go for a direct electrical brain stimulation. And so we find that the structure in the brain that's not working well, if it's overstimulating, like in the case of epilepsy, or if it's understimulating, we may have to implant a brain stimulator that fires off signals that allows us to regain proper levels of neuroelectric activity. Now, there is a phrase that we're going to be using a whole lot this chapter. I want to get you familiar with that, and that's the emotional state. The emotional state refers to a behavior. Now, this is a behavior that is conditioned through reinforcement. And so essentially what we're looking at is your internal behavior. This is basically how you feel. And so your emotional state could be very agitated, very sedate, very positive, very negative, very neutral. But it's basically your behavior. It's your, a little bit more than mood, but that's probably a good term to get us started into the concept. Through reinforcement means the fact that if every day you constantly find yourself, being horribly stressed out and feeling lots of negativity, and this is going to eventually then just condition you to wake up and go into that mindset as soon as you wake up. Now, the affect is the outward expression of the emotional state. This is what people see. And so if you're stressed all the time and very upset and mentally exhausted and you don't see any way out and everything just kind of looks negative, this may spill out to where people see that you're always very kind of depressed and kind of upset and don't seem to have much energy or interest. On the other hand, you may have a very positive emotional state. You wake up every day, you're going to tackle the day to get the best out of it possible, and your affect may come out as a very positive, very sunny, very, very positive, very sunny affect that's presented to people. And so by looking at a person's affect, we get an idea of their emotional state. Now, we do find that a lot of people who suffer a mental illness or cognitive impairment may have some physical illness going along as well. And so either the physical ailment causes a change in their emotional state, or their emotional state may hinder their physical health, may change their blood pressure, may affect their neurochemical levels, which may affect some endocrine functions. And so we tend to find a lot of mental illness is comorbid with physical. And so as you're learning about someone's physical health, pay attention to how their affect is. And as you look at their affect, be mindful that there may be something physically going on. So bear in mind that mental illness very commonly has a comorbid disorder along with it. When you want to diagnose someone with mental illness, when you look at the cause, not the diagnosis, the cause of mental illness, you can talk about 5 major groups that fit into what causes mental illness. And first of all is the emotional state. And so if someone has a very negative, very subdued, has a very repressed emotional state, that could have an impact on their mental health. Environment could be, your family environment, if you have an abusive or violent environment that you live in. It could be socioeconomic. If you're in a location, part of town that has very depressed economy, has you dealing with individuals that just don't help you to be able to reach a positive, upbeat personality. Or it could be a very positive environment to the extent that it could be so positive it's almost pressuring. If you have family members who are expecting you to follow a certain career path and you have to get straight A's, otherwise you're an absolute failure to the family, that kind of thing. Biological imbalance could be neurotransmitter levels are off because of diet, stress, exercise. It could be a tumor, a brain tumor that could cause an imbalance in neurochemical or neuroelectric function. Heredity, you may inherit a neurochemical deficit. Isolation could be social. You've taken a new job that has a night shift, and all of your friends are asleep at night and awake during the day, and suddenly you can't hang out with them. It could be geographic. You suddenly get accepted to a program in Pittsburgh, Pennsylvania. You move out there and you don't know anyone there. Suddenly that changes that you don't have a support system with people around you. Life changes. It could be big things like marriage, divorce, pregnancy, death of someone close. You suddenly get diagnosed with a terminal illness. Employment change. You suddenly get a promotion with a lot more pressure to it, or you lose your job. Lots of these can happen. So you can take a look at someone's mental health and see the factors that can go into causing mental illness. And very commonly, it's more than one of these that all work together. And so as you take a look at these, bear in mind, I could ask you to, describe, three different causes of mental illness that could combine to demonstrate how a person could develop an anxiety disorder or a mood disorder. That gets us started on the chapter itself, and so it helps you to get an idea of what we're going to be facing. The next set of videos are going to start looking at some of those categories and talking about examples of mental illnesses or cognitive impairments. Take your time reading through the chapter. It's a lot of new, original stuff, and so let me know if you have any questions. Good luck.